You are
Okay,
looking at
wait
the
for it.
first patients ever
It's still
transported
cold
by
there, right?
UAB's Critical Care Transport Service. U.S. Army Captain Christopher Tanner is Skyping in from Afghanistan, joining his siblings Anne Rain, Griffin, and Emily for their 30th birthday and CCT's 30th anniversary. The Tanner quadruplets kicked off the new service on March 23, 1983.
We didn't expect our first patient to be 4 patients.
The Critical Care Transport Service consists of 4 mobile intensive care units, 3 ground ambulances, and a jet. In the early 1980s, UAB physicians realized they needed a way to safely transport very sick patients between hospitals with the same equipment and the same staff found in a hospital ICU.
Most of our patients are coming from somewhere around in southeast U.S., coming to UAB either a baby or an adult patient that needs the specialized services that are available at UAB Hospital and UAB Medicine.
The Tanner quads were a high-risk pregnancy. They were born at UAB and were the first quadruplets in Alabama to all survive. As they grew stronger, they were ready to move to their home hospital, but not without a specialized ride.
I hadn't even thought about how in the world we would move, because how would you move 4 babies that are still in incubators? It hadn't occurred to me. I'm thinking, how are we going to move from one hospital to another hospital? I mean, we really couldn't have done it without the transport system.
The Tanners held the CCT record for most patients transferred at one time until Hurricane Gustav approached New Orleans in 2008. A hospital there, already without power, called and said they had 8 babies in neonatal ICU that needed to be moved.
So we normally don't transport 8 babies at once, and referring physician said, you need to come get these babies or they're not going to make it. So we went and got 8 babies at once.
The service has carried more than 41,500 patients from 48 states and 38 foreign countries, covering 23 million air miles and 6 million ground miles. They were among the first into New Orleans after Hurricane Katrina, and once had to use a gondola as ground transport in Italy.
So it's a great resource to have the UAB expertise at your fingertips, along with the equipment to take care of these really sick patients. This is the best job I've ever had and will ever have. One patient I picked up, the physician wrote back and he said, your team saved my patient's life. Now he's home and well. And that's what it's all about.